I'm Dana Cropper-Williams, Director of Education at HealthHIV, and HealthHIV is the capacity building corporation agency for the 1509 jurisdictions, the Thrive jurisdictions as they labeled themselves. Of course, here's the hashtag for the conference. We want everyone to post and everything, and I know a lot of people are doing that, so keep syncing. We've already talked about I have no conflict and no one else does. And usually if you're right on them, you end up with a vibration. Okay, sorry about that. Okay, quickly. Learning objectives for the Thrive jurisdictions are to increase understanding of social factors that affect MSM of color. You can read this. Also to identify model practices that improve the health outcomes for men who have sex with men of color, and to describe lessons learned in creating an accountable network of health and wellness providers. So THRIVE stands for Targeted, Highly Effective Interventions to Reverse the HIV Epidemic. THRIVE is a multi-site demonstration project. There are 7 jurisdictions in the site, in the demonstration project. And the project is meant to be a collaborative partnership between the health departments and their community partners. So the community partners are built around behavioral health, social health, workforce, all of these things that create a wonderful support network to promote services and promote equitable services for men who have sex with men. This is that framework that I just described, the health department working not only with healthcare providers, but also with behavioral and social services providers and other community-based organizations. The goals of the THRIVE jurisdictions are to reduce the number of new HIV infections and certainly improve outcomes along the HIV continuum. When 1509 put out the FOA for this demonstration project, it was built on not only core components for prevention, but also core components for care, and it was a blending of the two. So prevention has these 13 core components, and you will see pretty much a reflection, a mirroring of these in the care ones as well. But the lab-based fourth generation, provision of PrEP and NPEP, behavioral risk reduction interventions, and certainly linkage to care is a big one, and linkage to behavioral health and social services. There are many PrEP navigators throughout the program. That is huge. Promoting PrEP navigation, building PrEP navigator programs. Here are the care services core components, very similar. As I said, there are 11 of those. And here are the THRIVE recipients. So in Alabama, the area is really Birmingham. In Baltimore, certainly Baltimore City, District of Columbia. Louisiana is New Orleans. New York City, primarily Brooklyn, New York City. City of Philadelphia, and then in Virginia, it is the Norfolk Hampton Roads area. Now, when THRIVE started there in 2016, there weren't any collaboratives or anything going on except at the very local level, very few happening with some of the health departments. We've seen it grow considerably over the last couple of years. There's been an expansion of PrEP navigators. There's been an expansion of contracts, those funded and unfunded contracts with community-based organizations, and it continues to grow. Now, just talk a little bit about HealthHIV, and then I'm going to turn it over to our speakers. So HealthHIV, as the capacity building agency, was charged with developing a curriculum and providing technical assistance to the jurisdictions. And the curriculum, as I said, for the jurisdictions mirrors that. So we have a curriculum that is multifaceted, that is built to strengthen the health departments and their community partners as it relates to behavioral and social health services. And I think the good thing about this is the prevention piece, all of the things that we're looking at, is not only looking at folks who are living with HIV, but also how are we making sure that people do not become infected? So those folks who are also at risk for HIV. So that's why PrEP is a primary focus for the THRIVE jurisdictions. So we've created a curriculum called Transform, and the curriculum is part of a toolkit. and that is to provide education and technical assistance to the health departments and their partners. Certainly, it's all about cultural competency, being culturally responsive and appropriate, and making sure that we approve health outcomes for MSM of color. Here's a look at the toolkit. The toolkit should be up now. The curriculum, various parts of it are still in clearance, and we're still tweaking things, but everything looks good, and we are also available to provide technical assistance on any pieces of this as we're clearing the curriculum. So even though some of the modules may not be available yet, if you have a need or an interest in your jurisdiction, you can always connect with us, and we can make sure that we provide that technical assistance that would sort of mirror what the curriculum would do anyway, and several of the jurisdictions have done that. The curriculum is built in two parts. There is a training of trainers first there's a training of providers. It has 16 modules. 14 of those modules are online, and 2 of them are skills-based face-to-face trainings. From the training of providers, we do a training of trainers for a select group from your jurisdictions so that they can be able to navigate folks in your jurisdictions that want to access the training. The curriculum is built in several sections. There is a cultural competency section, a cultural competence, and there is a module on historical trauma and medical mistrust. And then there is a face-to-face module that is addressing racism, homophobia, and poverty. And then we have a prevention services module that has a prevention services component that has 3 modules in it, a behavioral health services component that has 6 modules in it, a clinical services module that has 2 modules in it, including sexual health history screening and HIV testing, social services module that includes workforce development, and a health systems module, and that includes community mobilization and peer navigation. Too many to name, so I'm just giving you the highlights. Once again, the content is 26 hours in total, 14 online, 2 face-to-face modules. And we have 6 modules that are CME-CE accredited, or will be. We've recently had a pilot of the curriculum, and here are some community partners and health department partners that were at the pilot. And here is our contact information if you are interested in any TA or have any questions about any of the curriculum or TA services. So I'm going to turn it over to the reason why you're really here, and that is to hear from the jurisdictions about what they are doing in the Thrive programs in their areas. We have a list of folks. I'm going to start out, and I'm just going to name everyone, and folks are going to come up in the order of their jurisdiction. So first, our first speakers will be Tony Kristen Walker and Travis Smith from Alabama, Game Changers in Alabama. Then we'll have Dr. Errol Fields from Baltimore City, followed by Deidre Jesse Hill, who's a PrEP navigator from Louisiana. Then Lena Sala, Dr. Lena Sala from New York City. We'll have Maurice Persall from Philadelphia, Darnell Barrington from Virginia, Bridges 757, and Chrissy Slagle from Virginia. And last but not least, Kenneth Pettigrew from DC.